think we're...
It appears that we're live, Ivan, is that correct?
Maybe it didn't work. Let me just double check on the live streaming. I think you can start. It does say that we're live, at least on Zoom. And I'll just double check with the other channels.
So I think we're going to get started. I checked the live stream. It looks like we're here. Welcome. It appears that we're live, Ivan, is that correct? We're here.
It didn't work. Let me just double check on the live streaming. Turn off the sound on your live stream.
Great. Well, welcome everybody. We're super excited to have you here for a special episode of the Veterinary Innovation Podcast, our second webinar. We've got an all-star cast to talk about a very interesting issue. So COVID has changed the world that we live in. It's definitely being felt by every one of us as we're here in our living rooms and spaces to work. Everything's changed that we once knew. And with that has come loosening of the VCPR legislation in a lot of states around North America. However, in some states, it's seen a tightening up of it. So we're really excited to have the guests here with us today. We've got Mark Cushing, CEO of Animal Policy Group. Give us a wave, Mark. We've got Doug Raven, the CEO from the Ontario Veterinary Medical Association. Welcome, Doug. We've got Christie Long, head of veterinary medicine at Modern Animal, and Shea Cox, founder of PetHospice. And of course, my somewhat awesome co-host, Ivan Zach. Welcome, Ivan. Welcome, everybody. Ivan, why don't you go ahead and get us started?
Hi, I'm Ivan Zach. Thanks for introduction, Shawn. So I want to open up with the sort of news from Canada, let's say. So we have Doug. Doug, I know that a couple of years ago when we were at VIS in Texas, we heard that Ontario applied first in North America the laws that permitted the telemedicine more than other jurisdictions in North America. So, and since then, during the COVID, from what I understand, there was an allowance to establish electronic VCPR as well as dispensing the medications. So I know there's a lot of fear around the different jurisdictions that the world is going to end and that it's going to be a disaster. Is there a disaster in Ontario, and how are we handling it in Canada?
Sure, I'd love to talk about it. First of all, just some quick background. People may or may not be familiar with Ontario. So Ontario is the most populous province in Canada. If Ontario were a state in the US, we'd be the 5th in terms of population. Capital is Toronto, a large metropolitan city. And again, Toronto is in the US, it would be the 4th largest city in the US after New York, LA, and Chicago. So back in September of 2018, our regulatory body, the College of Veterinarians of Ontario, which is equivalent of your state board, decided that it was time to move with the times and to allow veterinary practices and veterinarians to establish a VCPR via telemedicine. So you could do it solely by telemedicine. You did not have to see the pet in the clinic before you establish the VCPR. Now, the only thing you couldn't do with that VCPR up until recently was prescribe or dispense. If you wanted to prescribe or dispense, you still had to see the pet in the practice. But in the year and a half that veterinarians have been able to establish the VCPR via telemedicine, there has not been a single complaint in terms of a veterinary client concerned about the advice they got through the practice from the veterinarian and complained to the regulatory body. So CVO has not seen any negative consequences in terms of the provision of patient care as a result of that. Now, more recently, about a month and a half ago, CVO tweaked it a little bit and said, we told you before you couldn't prescribe or dispense unless you see the pet in the clinic. We're now relaxing that requirement. And if you think you have sufficient knowledge of the pet, if you can gain that knowledge through telemedicine, you can prescribe and dispense. And that's been really important here. I don't know what everybody else is seeing, but certainly in Ontario, it's International Adopt a Dog Month. Everybody, all these people who are quarantined, self-isolating, what a great time to get a dog, maybe just as a companion, or if you want to expand the family. You have all these new pets going into the household. It's flea and tick season. They need medication. They don't have a veterinarian. And it's been great for veterinarians to be able to have that remote consult and to prescribe and dispense that medication as needed. Again, that's only around for about a month and a half. We haven't seen any problems thus far. And as we move through the pandemic, we'll see how things go. But and the decision we made at that time down the road as to whether or not veterinarians will be allowed to continue to prescribe and dispense simply through telemedicine or a VCPR established through telemedicine. So far, things have gone great. There was concern that we might see a lot of non-veterinary players get in the marketplace and using this as an opportunity to compete with veterinary practices. That has not happened. That has not happened at all. Some folks tried it, but that standalone model of just dealing with folks via telemedicine and not having a practice that they can come to if they need care doesn't fly with the consumer. And so that has not happened, but we are seeing veterinary practices use this as a great tool to add to the services they already offer and provide a better client experience, more convenience for the clients. And it's just a wonderful tool, especially for all those people who have cats who never want to go to the veterinary practice under any circumstances and now have another means of dealing with a lot of the smaller problems.
If I could, I'd love to first of all, congratulate Doug on the success in Ontario. It's ironic that it took a Canadian province to provide the laboratory for veterinary medicine in the United States to look at the actual performance of telemedicine and take all the fears and speculation and go, did anything bad happen? And Doug made it clear it hasn't. We also have a laboratory of 49 states in the United States over the last 30 years that have allowed telemedicine to operate in the human healthcare space. And we don't have, again, the fears of, do we have a call center in Guadalajara or Sri Lanka that's somehow taking over my practice in San Francisco or Des Moines? It's simply not occurring. So you can raise theoretical arguments all day long, and they've been raised, and they're genuinely felt by people that raise the arguments. But in fact, Ontario's experience in a very sophisticated province, you could close your eyes, don't get mad at me, Doug, but if you open them, you might think you're in Chicago if you're in Toronto, except people are nicer. But the truth is, Ontario is a perfect laboratory, and they did it. And it's worth spending time. You could let Doug almost, conduct the entire webinar and teach people how they went from skepticism, fear, to this works. And more importantly, pet owners like it. And that's what ultimately state veterinary medical boards, California, Wyoming, it doesn't matter where, their jobs to protect the public and help the public. And I think the lesson from Ontario was the public enjoys this, wants this pre-COVID. In the COVID environment where you're afraid or not sure you should be congregating with others and going to a clinic, it only makes good sense. So congratulations, Doug.
Mark, I got a question for you. So recently, you've been one of the founding members of the VVCA. Can you tell us a little bit about the establishment, why you established it, and what does the organization hope to accomplish?
Well, you have to have an acronym in veterinary medicine. So VVCA, what's that mean? It's the Veterinary Virtual Care Association. It's modeled after the American Telemedicine Association, which is a 30-year organization in the human healthcare space. That's now a giant organization. I'm not saying we'll reach the same scale, but it's aimed at best practices, standards and policies, and allowing people that are interested in or in fact practicing telemedicine to convene, to share experiences, to learn again what works and what doesn't work, both on the commercial side of the business as well as the medical side, and a chance to have a group that could speak with one voice, ideally, about policy changes that clearly are needed in other American jurisdictions. And we've had a good start. 11 of us formed it, people, mainly practitioners that have been involved in telemedicine. and we're just getting started, but I think it's going to be an effective, enjoyable, informative, useful, and hopefully a fun organization over time when we can finally meet again. And again, it'll try to just move it to the next stage of people that care about telemedicine, curious or passionate and everything in between.
Yeah, it's great, Doug. Sorry, Ivan. We're getting a lot of people applaud Doug in Ontario in the live chat in YouTube. So keep the comments coming, everybody. We'd love to see them. Ivan, over to you.
That's awesome. Yeah, thank you. So let's ask Shea. Shea, so you worked with directly with clients in your initiative, the hospice. As far as I understand, and from our interview on the podcast before, you mentioned that most of the work is conducted remotely because these are the patients that you want to care for without, very frequent visits to the hospital. So what are you hearing from the clients and how they're receiving the telemedicine care compared to having to go to the hospital every time to see you?
I mean, of course, they absolutely love it, or I wouldn't be so passionate about trying to create change here. But hospice and the geriatric population is a very unique set of both pets and pet parents, and to be able to bring care into the home for them, whether that's in person or virtually, makes all the difference in the world for them. Things from my perspective on the VCPR along those lines is that most of our patients come to us through referral. So we have a veterinarian or a specialist, or oftentimes both, have seen this patient already, have made a diagnosis, have shared the medical records. I've spoken with the veterinarian. They are wanting us to take over care, and that's what we do. We usually go home with a visit or go into the home for a visit, establish the VCPR. During COVID, there's the challenge of, do we go into the home and put the families at risk, our staff at risk? And so it's a little bit frustrating that I can't offlift the burden of care for the specialists and the veterinarians who are saying, hey, can you help manage this case now? They're terminal. Here's everything you need to know. We have a diagnosis, and I just need you to carry on the care. We can't do that. And so there's a lot of situations where being able to have exceptions to how a VCPR is established makes a lot of sense. And hospice care is just one of them. But we've been actively using telehealth for over 3 years. We have our initial visit, and then the rest of hospice, whether that's months or years, is done all pretty much via telehealth. No problems, no tragedies, no complaints, as Doug would say. So it's an amazing tool.
Well, and the alternative for these animals is euthanasia, right? So the care that you provide, it's, let's not allow them to be on telemedicine, let's euthanize them. So I applaud to what you do. This is really great. Thank you.
Yeah, I mean, and one more point is, 70% of pets that are in the geriatric stage don't get care the last 17 months of life. So if we can move care into telehealth, the patients that need it the most can be helped. And Christie, it looked like you were wanting to.
Yeah, thank you. I was just going to add, I mean, you could do amazing work, Shea, and you take so much of the burden off of people in the last days of their pets' lives. Just hats off to the business you've established and the way you've been able to make a difference in the lives of people and their pets. I was just going to add, we're in LA and we opened our hospital 4 weeks ago today. Nothing like opening a veterinary hospital in the middle of a pandemic. When people ask me how it's going, I say, of all the hospitals I've opened during a pandemic, this one is going the best. But we have an entire staff of virtual technicians who form our virtual care team. We don't have a phone that rings into the hospital. The phones are virtual, and our virtual care team handles that. And the power of being able, I think, as a client, to be immediately on the phone or on a chat or on a video call with a veterinary technician who is experienced and can talk to you about, more than just the basic things that are covered with the front desk staff at a vet hospital. To not see that as an extremely powerful client acquisition tool is really short-sighted, I think, for a lot of veterinarians out there, because when we're there for them and we can help coach them through what's going on. Obviously, stopping short of diagnosing or prescribing, that's a very powerful, that's building a bond in a world that it's very difficult to build a bond, right? Over telephonic means. I'll also say that just prior to the pandemic, the largest veterinary house call service in LA, Vetted, unfortunately folded. So there's a population of people out there who are used to getting care for their pets in their home. And whether they're, homebound, or whether, like you pointed out, Doug, have cats or just, older dogs, there are a number of reasons that people don't want to go to the vet. I think we flatter ourselves and think that people are dying to bring their animals to us, when in fact, it's actually quite beneficial in many ways to be able to offer care in the home, whether it's through a house call or through a virtual visit.
Christie,
So-
I've got a question for you. Sorry. So my question is, you've opened hospitals before. Now you've opened a hospital in the pandemic. You're probably one of the only people that have done that, which is interesting. So what has that experience been like, and how has that support team enabled you to be where you're at? And what's it like on the ground? What's veterinary medicine in the middle of a pandemic like on the ground today?
Well, I don't mean to over dramatize this, but there are people who are terrified to leave their homes right now. And I think that those of us who go into the office every day because we're providing care, right? Veterinary care is essential, as the California board has reminded us. We get a little cavalier about it, right? So we're starting to feel more comfortable, but there are people who are terrified to leave because of their own typical immune related conditions, or just being afraid of what's going on in the world out there. So there definitely are people who are contacting us and saying, it's flea season. It was a great example you made earlier, Doug. Like, I just need to get my dog, his flea prevention renewed, and we can't do that for them. So they are left with perhaps purchasing an inferior product over the counter, or, calling a pet taxi service to have their pet shuttled into the vet, or just, obviously taking what they feel like is a big chance and coming out to see us. We do everything we can to keep it safe for people, right? We're doing curbside check-in. We have the added ability of having our app, our Modern Animal app, that allows us to get them on a video visit as soon as they come into the hospital, and they can be in a video presence in the exam room. We use our chat feature to send estimates and invoices, and all that's very streamlined. But it is, I think, we're seeing people just be very tentative about going out, and they'll go out once and they'll come into the vet once, and then they want to avoid coming back in at all costs. So they're taking advantage of things like we're mailing prescriptions to them, right? That's a very popular thing right now. They're chatting us and videoing us at all hours, asking advice on things that, whether they should come in for follow-up visits. We're doing things like follow-up skin rechecks, checking in on video. That's just becoming a really important part of our service that I think we always knew it would be in those normal times that we all put in quotes now, but it's just accelerated that piece of our practice so much more dramatically during this time.
Christie, so me and Ivan know a lot of the team, Steve and Avi, that support you, and we watched the Modern Animal journey. I think it's so incredible how you architected your offering with technology at the core, and now you're in this post-COVID world, or we're in this COVID world. And I think it's fair to say that the technology is what's allowed you guys to be successful in spite of the world that we now operate in. Would you agree?
Well, I think Avi would agree, Shawn. I'm joking because he is our product manager. I 100% believe that that's our secret sauce. We purposely did not, we're not keeping people out of the app just because you don't live within, a 5-mile radius of currently our only hospital. We're happy to chat with you and talk with you about what's going on. And again, that is an interaction with a licensed veterinary technician. Again, that I look at that as, the teletriage term we use, right? Help me figure out if I need to come in or not. But that is, again, I very subjectively would say probably 50 or 60% of the people we talk to, when that's our first interaction, are going to go ahead and come in and see us. A lot of vets aren't open right now. A lot of vets are having shortened hours. people can't get in to see their regular vet. And we've been there for them. So I think that has accelerated our growth out of the gates, and we are extremely busy despite happy month anniversary, Modern Animal. So
happy month anniversary.
Congratulations.
Thank you.
Yeah.
Mark, and then Doug.
Yeah, thanks. I think if you reflect just in the last 10 to 15 minutes on Shea and Christie's comments, it goes to the heart of the debate about telemedicine. And what's that debate? The organizations in the US that have taken a position to reform along the lines of Ontario, the Veterinary Innovation Council, the American Association of Veterinary State Boards, they've anchored it in the judgment of the licensed veterinarian on what she is comfortable with in terms of whether she can provide services of any sort to the pet owner, period. If you choose to be prescriptive and bake it into a statute, understand you're substituting the judgment of legislators, usually one of whom may be a veterinarian, for a licensed veterinarian. And it doesn't make sense. And the greater irony right now in COVID is that most states have been very careful in saying to veterinarians, ultimately, if you're worried about, should I use telemedicine or not? Can I see the patient or not? They always anchor that decision. These are governors now in what? The judgment of the veterinarian. In your experience, in your judgment, in your training, you make that call. And that's all the advocates for telemedicine are saying, is that ultimately those trained medical professionals have the ability to make that call, and don't make the VCPR a wall, some 30-foot wall you have to climb over to earn the privilege in America to go see a veterinarian. It ought to be a door. Come on into our system, come on into our practice. We'll talk to you about your situation. If you need to bring your pet in because we can't make a judgment without touching the pet, come on in. And people who think that somehow millennials in particular are going to say, hell no, I'm not coming in. The answer is, what's your address? What's the time? Can we come in right now? So we have this false dynamic. And I think ultimately, if you have confidence in the veterinarian, which the system ultimately has to have, then telemedicine is her prerogative in her judgment. And I think that's what gives me comfort. And then I think our organization, BVCA, feels the same way.
Doug, jump in there, buddy.
Well, just to follow up on Christie's comments, so Ontario has been in lockdown since middle of March. We're still in lockdown. That's going to extend well into May, most likely. We do a lot of economic research and study closely how our veterinary practices are doing. Those that embrace technology, not only through telemedicine, but we also offer service whereby our clinics can arrange for home delivery of product. It's all done online. Those who have embraced those kinds of services are carrying on pretty much the way they did, and the income's still rolling in. They're still doing lots of business. Those who didn't are scrambling. You know, I can't see the clients. I can't sell the product to the clients, especially during, you know, flea and tick medication season. And we're seeing a real disparity in terms of how practices are doing financially during this difficult time. You know, in terms of what Mark was talking about, yeah, again, if you're providing, establishing a VCPR via telemedicine, you are relying on that professional judgment that the veterinarian is going to exercise to determine what advice I can give without seeing the pet, and when it's time to say, you know what, I think at this point, you know, we need to see the pet and get the pet in the clinic. I also see that we have a question about cat owners. Are the, you know, cat owners finally getting the care that they need with telemedicine? And you know, I think it's too early to say for sure. But certainly with telemedicine, it's a great opportunity for the practice if they have a cat owner who's, you know, reluctant to bring the cat in because I'm not sure if the cat needs to go in and it takes me 2 hours to get them in the carrier. What a great opportunity to say, we're going to do a remote consult. And we're going to talk about the issues. And if you need to bring the cat in, well, then you can go through that 2-hour process of getting the cat in the carrier. And hopefully we can actually help you with that too. But over time, it's definitely going to have an impact in that area. And again, especially with people, whether they're elderly or they're right now just afraid to go out, those who have trouble getting to a veterinary practice. this would be a boon for them in terms of making sure that their pets continue to get care.
Thank you for that. And
Yeah, if I could just make a
yeah,
quick comment on Mark's comment. This is like, sorry, Mark, you're going to get me on my soapbox, but I always say, why would I have spent 4 years in vet school, a year and a half prior to that, taking all the prerequisites to get into vet school and studying how to protect animal welfare, only to decide that now, because I can do a video call with you, I'm going to throw that all away, right? Like, why would I, as a licensed veterinarian who values my license and knows how to practice veterinary medicine, not continue to apply the same standards of care that I apply physically in the practice to the virtual setting? It doesn't make any sense.
I want to know what our audience thinks of what Christie just said. So please feel free to put it in the comments. Ivan, over to you.
Yeah, well, I wanted to add that, you know, I've been watching the technology market and the environment in the last, you know, 7, probably 8 years in the veterinary medicine. And every time I turn back at Veterinary Innovation Summit or somewhere else talking about telemedicine, it's been a buzz. It's never been a concrete workflow. And this time right now, this allows us to leap into the future and basically understand very rapidly how we conduct this. And it's a great opportunity, I think, to actually adopt these workflows. One of the questions that we have from Rebecca Rose, she's asking, Christie, can you provide us, she's not sure if she should ask this, but can you provide an educational video? What's the blue book? You know, how do you do it? Because I know series of practices that jumped into telemedicine during the COVID time to adapt the business, to stay afloat, to provide the jobs to the technicians, to veterinarians, to everybody else. And they're struggling because this workflow is not adapted. And then now if there's certain regulations that are stopping us from doing that, when it's perfectly fine to deliver the care, it just kind of looks absurd to me. So I just kind of wanted to throw a little bit of fire in there and hear if you guys have anything to add to that. Mark?
Well, I'll just add this. You know, we talk about when COVID ends, and frankly, I think particularly the last 2 weeks, the science, the commentary makes it clear that the next phase is probably an extended COVID overhang, namely that people will be encouraged, if you don't have to go somewhere, if you don't have to gather with people, don't. Pretty simple advice. And if you've had in states a positive experience with telemedicine, or let's frame it the way my Catholic nun would teach me, not a negative experience, there's no evidence of death, harm, malpractice, you know, rampant in Ontario, for example. If you've had a positive experience and you have this COVID overhang that could go into 2021, could go into, you know, longer, why would you stop and say, okay, now as to pets, remember the rules, folks, you know, put your fork on the left, your knife on the right, and make sure your pets go into the clinic. Otherwise you don't get vet care. Particularly telling that cat owner who you've just had a great conversation with, since she finally understands how you feed your cat and all other things you might learn in a video conference. Nope. No can do from here on, and you've got to go in to see the vet clinic. It's politically not going to happen. And the stalwarts that are watching the show, and they may say, Mark, you're wrong. I've been told that more than once already today. The truth is, not on this one. You're not going to see states back away and say, when it comes to pets, get in your car, get in the bus, go to the clinic. Otherwise, you don't get health care. Sorry, you can get a new pet, but things don't work out. I mean, I'm being blunt, but the truth is, that's the political dynamic, and that's part of my job. And I don't think we're going there. So this webinar and others like this are great tools to tell people, relax, try it, get used to it. Sorry, Christie, I think I cut you off, maybe. Apologies.
No, I mean, yeah, I just, hi, Rebecca, by the way, hope you're well and safe. We spent a lot of time thinking about how telemedicine integrates in our workflows. You know, I've been on board with Modern Animal nearly a year now, and a huge part of our focus has been thinking about our workflows. And this is going to sound weird. I mean, maybe we got lucky because it turned out there was a pandemic and our workflows completely played into that. Now, I'm not saying we're, you know, the pandemic has been beneficial in any way, but we were uniquely positioned, I think, to pivot quickly just based on everything we've developed, the technology, and just our processes and how our teams interact. So it's been one of the most rewarding things I've seen since we opened is how our virtual team has meshed with our physical team. You would not have any idea that you were not talking with someone who was sitting right there in the hospital. And I would chance to say that our hospital team considers our virtual care team just as much of a coworker as the person standing next to them. So I think that's been a big part of it, is just having that luxury of time ahead of time to think about how it should all work. I know it's very different if you already had an existing veterinary clinic and had been doing businesses, in a certain way for years. That idea of pivoting and changing your workflows probably seems a bit overwhelming, but it can be done.
Shea, do you want to add to that?
Actually, I was adding to Mark's comment and a question for him. So, the telehealth train has left the station. It's moving full steam ahead. It's not going to go back to the station until legislation can catch up to what vets are trying to do for both pets and people. How can we best protect ourselves as veterinarians amidst all of these incongruencies in language, and no one knows what's right, what's wrong. So curious on your thoughts on that.
Well, I'll tell you, and Doug's the best example, and he's a member of a group, VMAE, Veterinary Medical Association Executives, and basically it's the provincial and state executive VMA, or directors of the state VMAs, and it's led by a longtime good friend of mine, Ralph Johnson, who taught me something. And Ralph, if he's watching this, thought which Brunello perhaps I should try with which meal. But in fact, Ralph has always made the point, when he was Colorado VMA executive director at Rebecca's state, that VMAs follow their membership, which is reflected in their board, but they ultimately follow their membership. And what's going to change telemedicine law in the country is not simply retaining a lawyer like me to go in and pound on the table or charm or whatever you try to do. It's going to change when the practitioners say to their leadership, you know what, we want this. And that's what's going to change. And I hope there's VMA executive directors watching, because I know they're experiencing that. And they're probably struggling with, do we go back to the old? And I think the answer is going to be, in most cases, not all. There are states that are dug in. There's one state in particular, a rather large state, larger than many European countries, whose VMA I work with all the time, and I have the highest regard for the VMA. Couldn't disagree more with their position on this issue. That's their position. But I do think as practitioners experience it, it becomes less and less productive ultimately for a VMA to say to the legislature, don't you dare touch the VCPR. It begins to sound like a solution in search of a problem. When you don't have the evidence from COVID, from Ontario, that anything went awry.
Doug,
jump in there.
Yeah, I think it's important to remember, as we talk about this whole issue of establishing the VCPR and what the rules are, the veterinarians aren't the only players in the game. You may or may not, people may or may not be aware that if you have an Alexa device, you can download an app to that device, and that robot on your counter can dispense veterinary advice to you. And that's completely legal. You establish the VCPR with your Alexa, and it provides veterinary advice, and that's just fine. But God forbid veterinarians should be allowed to do the same thing. I mean, you think about it that way, it sounds ludicrous, and it is. Again, so veterinarians aren't the only players in the game, and when it comes to a lot of things, especially technology, in Ontario, we've always taken the view that if we don't own the technology and the use of the technology as a profession, someone else is going to come in, organizations run by non-veterinarians, and they're going to come in and see this opportunity and take advantage of it. And veterinarians will either be scrambling to catch up or perhaps left out in the cold completely. And so again, in all of these things, we've always taken the approach, we need to lead. We need to look at how veterinarians can use the technology, again, to enhance the practice, to enhance client care, to enhance patient care. And if we do that and do that well, and we've seen in other areas in Ontario where we've sort of kept out competitors because they've seen an established presence in Ontario where we are managing that technology and doing a good job of it. And so there isn't that business opportunity for others to come in and compete. So in addition to providing great client and patient care, it really is a great way to make sure you're controlling your own destiny as a profession, as opposed to having to try and do what I think the profession has allowed to happen in a lot of areas, which is let someone else start doing online medication ordering and delivery, let someone else provide certain services, and then go, oh well, and try and cope with it after the fact. I'll get off my soapbox now.
Well, there's another question for Doug, and it's around what's the role of the Veterinary Association in creating the environment where the practices aren't afraid to try new things? Was Ontario driven mostly by the practitioners, or was it the governing body? Who decided, where was the fulcrum when you decided that you would go with this this regulation being sort of loose, or not loose, but not as hard?
It was a combination of things. I certainly give our regulatory body credit for being Jan Robinson, the registrar who runs the regulatory body, is very, very forward thinking. And she and I actually coordinate in a technology working group that involves folks from around the world. And we have regular meetings to talk about where tech is going, including around telemedicine. But what really, to be honest, what really got our attention was the Alexa. And when that came out, it was like, whoa, okay, this is going places, and we better get on top of this or we're in trouble. Has lots of conversations with the regulatory body about how we move this forward. Started talking to some folks in Ontario who are looking to get telemedicine practices going or services going, and to talk to them about how we integrate that into practices, and so the practices can make that an extension of what they do. Again, a lot of people tried things that didn't work. We have a veterinarian, one of our members right now. I'll give her a shout out. Dr. Sharon Quinn has started up a service called Smart Vet that we, as a member service, that we promote to our members. And it's a great platform that veterinary practices can use to get up and running really quickly, and offering a full range of telemedicine services, whether it's video or chat, video, chat, and phone. And enables the veterinary practice to one of the struggles a lot of practices have had is, how do I charge for it? How do I implement telemedicine in such a way that I can actually do it and make money doing it? And one of the things we love about Smart Vet is it's that commercial aspect is built into the platform, and it makes it easy to not only offer the service, but make sure you get paid for the service, which is important because you're running a small business. So it was a combination of, I think, of OVMA, of our regulatory body, and certainly folks in the province who are looking to move this forward, working with the profession.
Doug, there's another question that I'm going to direct at you as well, which I think is interesting because we talked about this when we were preparing for the webinar. So the question is, what do you think about telemedicine providers that don't have a fixed mailing address? And what does that look like in the confines of veterinary medicine? Can a veterinarian in Ontario, say, provide healthcare to a pet in California?
That's a very interesting topic. Now, in Ontario, in order to provide telemedicine services, and again, I know it's different in different states, but not only do you have to be a licensed veterinarian, but you have to be offering the service from an accredited veterinary practice, which has been accredited by a regulatory body. I know that across North America and around the world, veterinary regulatory bodies are looking at this issue in terms of where you have a practice in one province or state providing services elsewhere. How do you regulate that? And if there's an issue that arises, who deals with that issue? Is it in the jurisdiction where the veterinarian is working, or is it in the jurisdiction where the client resides? That is I know the American Association of Veterinary State Boards, I know, is working on that, and our regulatory body is involved in that organization as well. And that's one of those things they are still trying to work out. But I think sometimes that again, thrown up as, well, that's another reason we can't do this. And I don't think that's really valid. That's an issue that they'll have to sort out, but it doesn't have to be a barrier to veterinarians embracing telemedicine.
Yeah, Doug, I agree with that. The one sort of experience that I think that we as veterinarian already have with that in I guess it's teleconsulting which is, I think, the right word for, let's say, radiology services. We can get advice for a boarded radiologist in another jurisdiction based on the fact that I'm the care provider at the jurisdiction where the care is given. So maybe the same logic applies. I don't know what, what the impact, but it's not uncommon, and we're halfway there. So just creating the rules around it, but not prohibiting it, totally makes sense. But I want to throw another question here. It's so this one is probably a hot topic. So how can veterinarians successfully engage in using telehealth, be a succinct voice at the state board? So how do we make it in the states or provinces where it's not adopted? What can we do to actually raise this issue to the level where they hear us? Mark?
Well, the place to start is the state VMA, and to let them know that you care about it, and just express to the VMA board, if you will, that you're interested and you want to see progress made. Secondly, state veterinary medical boards, the majority of the members, all of whom are appointed by governors, are veterinarians. Often members on the board. Let them know. I mean, part of it's just the boards and the VMAs thinking that practitioners care. Ultimately, to go to the legislature, which you have to do to change the law in a number of states. The typical American legislature on veterinary matters turns to the VMA and often the executive director and says, what do you all think of this? So you want that answer to be either we're open to it. It'd be great to say we're rabidly passionate. Sorry to use rabies, but it's a veterinary webinar, so I'll try to pretend like I'm a doctor here. But the point is, you want the VMA to say, at worst, we're interested in it, we're open to it, we get it, perhaps circumstances have changed. Everything I just described you can do without hiring a lawyer, hiring a lobbyist. It's just letting people know in person that you care. The great thing is you have in the AAVSB, the Association of Veterinary State Boards, you have their model language. And this is by no means a radical organization. These are members from every state board in the country, and their job's to regulate, their job's not to change the universe. But they thought it was useful, and they ultimately had a process over a year or so and then passed a new model language. And you can hand that language to the boards because they're familiar with it. They've all seen it. It doesn't mean they all welcomed it, but they've all seen it and they know the process behind it. And that's how you get started. And then the truth is, a lot of practices, a lot of companies in the animal health space, if they weren't there before COVID, are there now. And I know it because VVCA, I get letters and calls, or letters, who gets a letter? I get emails and calls every day from people saying, how can we get involved? And it's not a full-time venture for me. I'm not trying to turn it into that. But the point is, I'm a name that's associated. So I get that outreach. It's very clear people want to see this. So I think others will pick it up. And I just start that. If you have 8 people in your practice, including vet techs, have them write a letter, or an email, have them make a phone call. To let folks know. It sounds like old-fashioned democracy, but that's really what needs to start it.
Christie, you want to?
Yeah, I mean, just to tag on to that, I mean, one of the things that the Veterinary Medical Board in California is very open about is that they're there to protect the consumer, right? And we talk a lot about consumers wanting this and this being a consumer-driven process. And I don't know, Mark, if you have any thoughts on that side of it as well, right? I mean, I passed the dentist office here in where I live the other day, and they had a big banner that they had clearly just erected during COVID-19 that said teledentistry now available, right? And so, as the consumer starts to look around them and say, I have all these options for my own health, why do I not have it for my pet's health? And I'm just, maybe Doug, if you have some insights on whether there was any consumer involvement in the Ontario movement, and how we could channel our clients towards that kind of effort as well.
Just quickly, I don't think there was a lot of consumer push in Ontario necessarily, but like the US, we have those same models in human medicine. And our medicine's a bit different. We have universal healthcare, go Canada. But again, as part of that universal healthcare, there's Telehealth Ontario, and so everybody knows that that's available and there's access. And so I think just to follow on Mark's comments, use those examples. Point to those examples in human healthcare. where this is information is available. And be ready for some of the arguments which are going to be thrown at you. You know, there's the argument, well, you know, pets can't talk, and how that somehow invalidates, you know, the use of telemedicine, which is absurd. We know that telemedicine is widely used in pediatric care. Again, there's so much you can glean remotely, even if the pet can't talk. And again, if, as you know, as Christie has been commenting on, as Shea has been commenting on, if you don't have enough information to determine the treatment or prescribe whatever you need to do via telemedicine, you don't. You use your professional judgment, all those years at vet school, and you say, you know what, you need to come in, and you go from there. So yeah, but I think that, you know, look for those examples in human medicine, because when you look at what's going on in that side of the equation, it's really hard to argue that this somehow doesn't translate into veterinary care.
Yeah, I remember back to 2015 when I started working with my first startup, and my boss at the time asked me, what is this VCPR thing? And I had to stop. And somewhere back in my mind, I remembered Mark Opperman saying that to me my third year of vet school in our practice management class. Because at that time, as a practicing veterinarian, I mean, yes, I knew I captured a legal relationship with the client every year when I saw them and their pet, but it didn't drive my medical decision making, right? I knew I had that. I knew I had consent. We did what was best for the pet, and this idea of the VCPR did not enter into it, because I was still going to use my clinical judgment based on my years of experience and training, right? And now the VCPR has taken on almost this mythical, you know, status as this thing that's not going to allow us to make a mistake in our judgment if we don't have the pet in front of us. And I find that to be ridiculous. I've missed things on pets that were standing in front of me and that I had my hands on and my eyes directly looking at them, right? And we've, all of us, probably done that. So it's almost, I love Mark's characterization of a solution in search of a problem in this case, right? It's not the end all be all, and it doesn't mean you can't do the right thing for the pet because you don't have that.
Shea, I think I'm going to get you and then Mark, but I also want to ask our audience a favor. Hit the thumbs up button if you like the conversation so far. And if you're not afraid, hit the subscribe button, and we'll keep you tuned into this kind of discussion that we're doing. Shea, over to you, and then Mark.
Do you have a question for me?
Just, they really look like you wanted to comment, but if you don't, we'll just skip you and go right to
where my brain goes when I hear this conversation is, you know, we're looking at language that's decades old, and it hasn't evolved as consumer behaviors has evolved, as medicine has evolved, as practitioners have evolved. So we're being stuck behind this wall of old language, and our hands are tied, and that's a real frustration. It's a real frustration.
Mark, jump in there.
Yeah, I'm going to, one of the members of the audience shot me a note, great point. In the US, some people think, well, we can't change the VCPR because the FDA, the Food and Drug Administration, has a rule that in effect mandates it. Well, let me be real clear on that. And this is the lawyer in me coming out. The FDA regulation is limited to extra labeled drug prescriptions, tied to a definition of a traditional VCPR being created. I don't think any professor in any vet school in the country would say, we spent 4 years teaching you to go into a profession where all you do is write prescriptions for extra labeled drugs. I would take the bet, and I enjoy sports betting, I'll put that out front. I'll take the bet every time that the average veterinarian spends 98% of her day doing something other than writing a prescription for extra labeled drugs. And if you want to protect against that, you can continue to, because some human med telemedicine statutes, unlike like Ontario did here for the first time, pull back prescription writing from the telemedicine process until they get comfortable with it. You could do that. You know, that would be something a state could try. Ontario did that. COVID allowed them to take the next step. But the point is, it's a false argument if you're hearing that federal law doesn't allow you to do this. It just has a limitation in one small area. Last point I'd make to Christie, how do we get these states to change? Let's have every state put Doug Raven in his manicured, perfect Ontario library in his home with the books on both sides. I love that. And say that this radical led an organization in Ontario that transformed telemedicine. My point is, their experience is one that until somebody can say that it didn't go the way it's gone in Ontario, you don't really have the case against telemedicine. So I think the best decision this webinar made was to have Doug participate, and I really appreciate him sharing the experience. And I think you can get all the learning you want from them, and it'll lead you to one conclusion. So Doug, if you've got some time over the next year or two, we're gonna give you a chance to talk to a lot of folks down here.
Yeah, the hardest part of getting ready for the pandemic was running out and buying all these books. So I'd have a nice backdrop for all these Zoom calls. One of the things I wanted to mention, because again, we're looking at the present. I'm going to look at the future even more. I have this lovely Fitbit that tells me all kinds of stuff about my health right now. I see Christie has her watch probably tells her a lot more than mine. Everybody's got one of these. Wearables are huge in the human world in terms of telling us stuff about it. And one of the big new trends in the veterinary world is going to be wearables for pets. So there are going to be devices that are going to be available. They're going to provide a lot of information about the state of the pet. And there is a potentially great opportunity if veterinarians embrace telemedicine for veterinary practices to be tied into the data coming off that wearable, and to have more information at their disposal, whether they're doing a remote consult about the state of the pet, make even more informed decisions, and again, have more information about when it's appropriate to provide telemedicine and when it's appropriate to get the pet in the practice. So again, we need to be looking forward. I mentioned we were getting ready for this call. We had a pre-call, and one of my idols is Wayne Gretzky, famous hockey player, and how we always talked about his success was based on going where the puck was going, not where it is. And I think as a profession, we need to be doing that all the time and saying, where is technology going in the future? And what do we need to do to make sure that we're in a position as a profession to take full advantage of that technology as it evolves?
Yeah, and just a quick shout out to one of our previous episodes of the podcast, shameless self-promotion. We just had our first wearables episode, so check out the podcast after the webinar, because I think that is going to be a massive area of emerging technology in the vet space.
Mark, you had something to contribute? Okay. Well, I think that we have our questions answered, and I want to thank everybody for participating in this panel. Thank you guys very much. I think that this, I'm hoping that this will create sort of the awareness of how Canada can show an example of what is possible, and that it's not dangerous. And then we don't have the reports yet that this creates an issue that is preventing the rest of North America of not doing it. So this will be recorded, and please pass it on to your friends that might be interested in the topic of telemedicine. I also want to give another shout out to Mark, who started the VVCA organization. If before we conclude, maybe Mark, if you can give us a couple words on how to join, how to be proactive, how to participate in this to support you in this.
First of all, a group of us started it, and a majority of whom are veterinarians, and all of whom I'm sure had SATs slightly north of mine. So it was a team effort. I believe it's vvca.org. My partner in my business, Allie McIntyre, is, I'm sure, shouting at the screen if I didn't get that right, but it's just Veterinary Virtual Care Association, but I think it's vvca.org, and go to that site. And it's an early site, so it's not what you'll see in a year, but I think it'll get you started, and you'll begin to hear more about programs, even in the virtual environment, that will be launching soon.
So I guess that's it, Ivan. Stay safe, everybody. Thanks for joining us for this special episode of the Veterinary Innovation Podcast. If anybody on our panel has anything that's burning that they have to say before we conclude, feel free to jump in. And if not, it's been fun. Shea, go ahead. You have the last
One
word.
last thing, speaking to Mark's comment about get involved with your medical boards and such, and that's where you can, begin to make change. If you go to the veterinary medicine closed Facebook group, which if you're listening, this, you're probably already involved in that. Jessica Vogelzane started a great petition for California. We've been really active trying to have discussions with the California Veterinary Medical Board to broach this. There is an emergency meeting happening on May 14th to tackle this subject. So the voices that we're saying are making a difference. And so there's another meeting for that. So I think you'll put the links up, but sign the petition if you feel that, telehealth is needed and the way we approach things, and attend the meeting on the 14th. There'll be lots of links for that too. So that's my plug.
Thanks, everybody. Thank you guys for dedicating the time. I think it's a very important topic, and hopefully we'll come out of COVID, but with telemedicine.
Goodbye, everybody.
Cheers.